Just to add something, at the beginning it was supposed to be Eva Gunberg who do this lecture, and she's in an island in Sweden. My sister-in-law is Sweden, and I know this island. There is very bad connection, and since 2 months we are trying to reach each other, and it will be worse than with her on the lecture. So finally, Leonor, that I invite a couple of years ago for a symposium, and she has problem with visa. It was not easy at that time. Her visa was not able to come. So finally today we have her, not on the best quality we would like, but just to let you know, I invite Eva Gunberg a couple years ago, and she showed to everybody something amazing she has made. She's Sweden. She has made a study in Sweden. After that, she graduated on a higher level in Switzerland, and she become one of the leader in obstetrical research. And she was so impressed by the discovery of natural oxytocin that she wanted to make an experimentation. And so she has been in a very poor country in Venezuela. Well, a country not so poor than that, but which has very bad condition. And she chose a population, the worst population for delivery, which is a girl before 18. And most of these girls have got babies not desired. In fact, most of them was raped. So it was really the worst situation. You know that more the pregnancy, the conception is terrible, more the birth is terrible. And so she takes finally the population which has the high level of necessary C-section to make the difference between over medicalization C-section. And she takes this population and she develops her concept of vertical birth to prove that by using certain position we could completely reduce this fatality of having C-section in this worst situation. And she had something that really make me smile. She take beautiful guys who was, because most of the time these lady are rejected from their family because they have been raped. More world is crazy, and so they are on their own, and she make a kind of shelter to take with her this lady, and she take care of her like a mother, and she invite beautiful guys, and she use a dynamic of these men with the lady during the labor, and finally by smiling, guys with nice guy, and and she involved them to really act and dance and enjoy them during the labor, respecting of for moment of silence or be retired as soon they need. They come, they massage. They're like husbands, and and she play on the hormones, masculine hormones, if you want, to secrete these oxytocin. Michel Odon got this famous word to say we should deliver as we make the baby. And so she really immersed this lady in the making love, and she has 3% of C-section. It's really, everybody was flabbergasted on such population to have that. We don't have that in very good situation, and so she has developed tools to help vertical birth because we are people who are sitting all the time. We have not enough muscle to do vertical births, as in certain country where people walk all the time. But it's helped a lot the delivery, this position. And so she has developed tools, different kind of things that she presented to help this kind of birth. So it was a little ad to have a bit Eva with us, which is an amazing obstetrician.
So to start our last straight line already of the Congress, we will now watch a 20 minutes video on pediatric osteopathy. There are a lot of osteopaths in the room here this afternoon. I think almost all of the osteopaths of our area are here, which is amazing. Big applause for the osteopaths. Very well represented here. And so it's on pediatric osteopathy by Bruno Ducou. So enjoy this 20 minutes video.
At birth, after a long wait, parents discover the face and body of the baby they have dreamed of. The mother carried this baby for 9 months without being able to see him or her, having already developed an intimate dialogue, heart to heart. At birth, the baby's body memory is far from being virgin. Many sensory experiences have shaped this little human being that parents discover on that day. The smell, taste, touch, hearing, balance have imprinted a lot of information over 8 months. The birth brings an initiating experience which is both difficult and necessary. The baby and mother are to be congratulated for the successful outcome of this uncertain battle. The asset of information from birth, in addition to genetic information, epigenetic and the sensory antenatal imprint, form a huge reservoir of memories and equipment for life. The intervention of the osteopath within the team that accompanies the baby and its parents is a dialogue through 3 sensory channels. These are the baby, the environment, and the osteopath. The sense of touch is particularly developed by the 9 months of aquatic life, and on the threshold to aerial life, it's not so much manipulation, but an exchange with feedback. Functional disturbances can be greatly improved: crying, sucking difficulties, digestion, bronchitis and respiratory problems, neck injury and imbalanced head position. La grossesse s'est bien passée?
Très bien.
Et l'accouchement?
Ça a été.
An osteopath looks for what the body of the baby is showing us,
Voilà. Mais sinon.
the way the birth happens, the memory of the position in the belly. Take away the negative tensions in the body.
D'accord.
Growing, he can develop nicely. It's a sensibility to touch. Can you feel what's happening now in your own belly, mother? The consultation begins with the intention of the parent to present their baby to an osteopath. His or her availability, professional competence, and right attitude is dominant in this exchange. The osteopath seeks manual contact through palpation and perception. This constitutes a fulcrum, a vibratory fulcrum, opening the field of communication and exchange with the baby and its environment. il n'a pas fini ce mouvement de sortir. His head is going backward because he didn't finish his movement of birth. This movement is present already in the belly during the pregnancy. Now he's taking a support on his head.
Le 9 octobre.
Donc il y a 3 jours.
3 jours, ouais.
Voilà. Petit à petit déroule. He's doing the unwinding used during the delivery. Voilà. Étire bien tout le dos, finis le mouvement. Now he's finishing the movement. Ouvrir les mains, changer au niveau respiratoire. Can you see the change of breath? Là, il fait un temps de
And
pause.
now there's a pause.
Donc, c'est important de respecter les temps du bébé. Et vous pouvez ressentir dans votre ventre. Voilà, sentez la détente là qui s'installe. Voilà, Arthur, continue. Et petit à petit, il ouvre une main.
I am an obstetrician gynecologist whose mission is to support the best possible parents for the birth of their child. There are mothers who deliver their babies very easily over obstacles without any problems. It is what we call the photopelvic confrontation, a descent into the pelvis with rotation of the head and passage through perineum. But sometimes the delivery can be difficult, unfortunately, with a need for forceps or a caesarean section. Babies can undergo significant pressure constraints. Some babies are born with a rugby ball head or a bump on the skull and asymmetric strains. These strains are not necessarily linked to the birth itself, but may also be due to the bad position in the uterus before delivery. All these babies should be entrusted to the hand of an osteopath accustomed to work with the newborn in the day following birth to affect the structural balance, and it was we are trying to do, with parent consent of course, and with the collaboration of our pediatrician.
Now he's back in flexion mode.
Ouais.
Il a la tête un peu en inclinaison, vous voyez, sur le côté.
Ouais.
Can you see his own vertical axis? He still has hands closed.
Et là, si on étire bien, si on aide bien à étirer
Fulcrum behind the head.
en mettant un point d'appui derrière la tête et dans le dos. Vous allez voir, il va relâcher le système respiratoire et puis le ventre.
It's a good prevention for colics.
Voilà, sa respiration commence à être plus profonde.
Breathing is better now.
Très important parce que dans votre
There's more efficiency.
il avait pratiquement
When
pas de
the baby was in your belly,
digestion. Il sent que ça
they had no digestion, no breathing.
base de la nuque. Un système respiratoire plus efficace.
Now the throat is releasing.
Très bien, continue. Laisse aller. Bon, ça a été un peu difficile.
Ouais.
Donc, voilà. En même temps qu'il relâche, vous allez sentir comme ça, il fait du bien. Voilà. Allez, voilà. Tu peux t'étirer. Et s'il relâche bien la gorge, il va bailler ou... Voilà.
Ah oui.
Ça y est, il commence à relâcher. Voilà. Regardez comme c'est important d'ouvrir tout le haut de la nuque, la gorge. Allez Arthur, tu relâches jusque les mains. Voilà.
Arthur,
Ouvre les bras.
open your
Il y a de la
arms
place.
now.
Continue à ouvrir. Voilà. Là, c'est vraiment la base
Get
de
free of the tension in the base of their skull.
la charnière obstétricale, un endroit où il appuie à la naissance entre les différentes parties de l'occiput. Très important de relâcher ça. Et oui, ça a été un peu difficile, mais tu vois, c'était important que voilà, qu'on vous aide.
Ah bah
C'est
oui.
avec le péridurale.
You know,
c'est plus
with the
difficile de
epidural,
pousser bien.
it was difficult for you to push.
Allez,
Oh, ouais.
voilà. Pour moi, ça appuie sur l'oreille droite. Il s'appuie. Now he's pushing on the right here. It's good to prevent otitis for the future. Il continue à relâcher. Un autre moment de détente.
Since 2004, the French state recognized osteopathy, and thanks to the obstetrician and the management of our establishment, we have been pioneering an osteopathic care to babies in our maternity. Osteopaths take care of our children less than 6 months old because it's right after the birth and during the first 4 days of life with the agreement of obstetrician. Thanks to the obstetrician, osteopathy exists within our maternity and brought wellness to newborns. It's always in agreement with the mother, then the osteopaths take care of their children and under the guidance of midwife, auxiliary nurse and pediatrician. It happened gradually that it's to tell the child, then another. I'm not saying that all children have to be seen because all the babies don't need it, but the children we believe need to be seen are seen. It seems that parents are happy. Children seem to be very relaxed afterwards. We are obliged to say, yes, it is true, it's a well-being. Yes, is it true, the children looks good. Yes, is it true, we need them.
Just let it go. Stretch, relax. Feel how good it is. The concepts of axes in the space of the body and limbs, tension patterns, pressure, and restriction of mobility will guide the movements of the osteopaths in search of health present. The purpose is not to diagnose disease, which is the role of the pediatrician. Ça y est, regarde, tu peux laisser aller, étire-toi. Relâche les mains. Voilà. Sens comme ça fait du bien de sentir. Health manifests itself by a neutral point of calm and tranquility around which the tissues will reorganize themselves. It's a direct informational approach addressed to the sensorial and nervous system of the baby. C'est pour ça que c'est important dès le départ de leur apprendre. Ils ont une capacité d'apprentissage, voilà. It's really important to learn from the very beginning of life, because it stays the whole long life. The nervous system is not yet mature at birth. It's essential not to seek beyond the possibilities of the moment. Encore un peu de tension, mais le se relâche de plus en plus. The emotional reactions of the baby and the environment are part of the treatment. The emotions, put into words, eliminate the bodily memory of a past that may already be a burden for the baby. Digestive and sleep disorders may be the consequence of that burden. Parents are most concerned about the importance of touch and the continuity of the skin-to-skin relationship with their baby from birth.
For me, it's something I don't know, as most doctors with a prior ID against the osteopath. And it is true that we really feel that osteopaths used to work with newborn are really good for these children. I think we are a very open team. We also practice homeopathy. It is true to say there was some intellectual curiosity for osteopathy. And then we realized that it could bring a lot of things. Sometimes during a session, we realize that the baby is actively participating in the treatment and then fell asleep. The moms tell us that they have their baby much more quiet with better nights.
Il y a un travail. Concentré sur ce qu'il fait, et quand ça sera fini, il va le manifester aussi. Petit à petit sous la main, sous le manche, avec plus d'amplitude. Under my hand, there's more movement now. See the good concentration. He's smiling because mother is making compliments. Tu réagis très très bien. Tu laisses aller. It's not by pulling the petals of a rose and giving it chemical fertilizers that we help to grow smoothly. In the same manner, as a well-planted shrub will develop long roots, it guarantees the future power of the tree, beauty of its flowers, and sweetness of its fruits. This can be linked to the exchange with the osteopath, which reveals the power of the baby's immune system and offers him or her the useful tools for defense, not only during the early years, but throughout life. For these, it may be necessary to see the child several times and follow them up regularly throughout growth.
Hello. So now you know a bit better what osteopathy is, because it's really unknown in our area. There is around 1,000 of osteopaths in Quebec, and there is 38, I think, in the West. Don't know if it's exact. Perhaps it's more. I mean, in Calgary, probably there is perhaps more, and we have the chance to have nearly all the osteopaths of the Kootenay here. So eventually, if you don't mind, I invite the osteopath to come here and to answer some questions that you could have. If you would like to, I don't know if you're shy or I can answer, but it's nice to have a difference. And I don't know if we have our Julie is here. No. Oh, you're here. If you want to come, don't know. Yes. C'est bon. Ouais, je pense qu'on va rester. Crystalline. Okay, we need to have a picture. Yes. Oh my God. We feel so lonely and it's finished. You have a moment, an emotional moment right now.
The first time.
First time, exactly. So, do you have some question for us? Because it's probably brand new for you, and you have got some few sample in the movie, but you could have other question. We are there to answer. Here. Oh, here. Guillaume. Non, il est là. Il est juste derrière. Le micro est juste. Non, ici. No coffee after lunch. Ici,
I would like to ask you, how can you help pregnant women to give birth in a better way?
Actually, Julie is now the president of Julie is the president of the BC Association of Osteopaths, and she has been named very recently, so we're very happy that she would be here today.
Thank you, Crystalline.
My pleasure.
What was this? An ice cream cone? Yeah. I think the nicest way to support a woman who's pregnant is to help her be in balance with her baby and in balance with gravity, and help the baby to choose the wisest position for delivery, which is facilitated when you free up all the strains of our experiences, which can be emotional, can be physical, can be falls. And when you can bring a pelvic bowl and all the pressures of a person into balance, then you create a nice intrauterine environment for the baby to choose a good position to come through the passage.
Is there any difference in the baby's body when the deliverer is in a vertical position or either in a horizontal position? Do you see this in your practice?
Personally, I don't know that I could discern the difference. Maybe you could. I certainly can discern if a baby has become stuck in the passage, for sure, or if a baby's been extracted from the passage. You feel that in their membranes as either a compression or a distension. I'm not sure that I could see the difference as well.
Just to add on that point, mainly the nerves and the big vessel are behind, close to the spine, and so the problem is that when everything is fine, the uterus is tonic, has enough forces, it's not too long, everything is in suspension in the body. So you could say deliver in any position, but when you start to become tired, you lack a bit your strength, you have a problem of elasticity in your body. At that time, everything is going to follow the gravity, and the body is no longer suspended, if you want, and so you could have much more compression on that posture. But when everything is normal, any position could be good. That's why what Julie said, to help the mother to be first free on her whole body, and to help through what midwife, doula learn to change posture, to take any kind that feel better for you, and to be in tune with your sensation, will help the baby to find the best way. And for that, all posture are good. Feel good.
I think also to add in, when a baby presents posteriorly, we see a lot of facial compression upwards, which can also be treated from an osteopath, and that may reflect in problems later on, such as breathing difficulties, attachment issues when they're feeding, and also a lot of compression through the back part of the neck when they're posteriorly presented. A lot of extension happens through there, so that can all be unwound and treated quite successfully, I think.
And to make publicity for what we do every second Saturday, we have at I.D.E.A.L some meeting organized by our so lovely midwife, and it's to learn tips, specifically this I was talking suspension before because the body is natural built like suspended, but there is a very easy technique to learn to be 4 point, and learn to the husband or to the midwife to take the baby in the hand, and let in fact the baby fall on the hands, and you use 3. In osteopathy, everything is working with 3 parameters. So we try to find 3 parameters of ease what we call ease. And at that time, you give a rest for the uterus and for the baby, and you give what we call a fulcrum. This means a point, a support, reference point, and at that time the baby is able to turn. And we have got a beautiful experience. First time after the course, Jane, which is not here now, she's not yet back from delivery. Don't know if Sivan, you was with her when it happened? No? But I was so happy to see that just after one session, the man was able to do this suspension and the baby was posterior and he turned. So it's really that kind of techniques which are so simple to learn. It's take a bit refreshment in geometry, but it's not so hard. And yes, there is ways to help that like that.
I have another question.
Yes.
We are very lucky to have Francois to teach us a lot of things. And what he lately said also is that there is a relationship, can be a relationship between postpartum depression and the coccyx. Can you say us a little bit more about that and how we can help prevent or heal postpartum depression just by working on the coccyx?
Oh, you make an anticipation of the following lectures. But is someone to talk about that? Well, there is a ganglion at the end of the spine, just before the coccyx, the tailbone. I think it's a name that you use, and just in front of the tailbone, this is the end of the. You know, we have two sides of parasympathetic chains who rule the subconscious, if you want. The subconscious nervous system or autonomic system nervous, and it ends just in front of the tailbone with this ganglion. And when there is a time of latence, when the baby stop moving, that I talked this morning, which was not so good, each time the process stop. Until the process continue, there is some action, there is a dynamic. Life is movement. But when there is a stop of movement, that's when the structure are compressed. And if it's happen when there is a moment of the crowning, when the head is nearly out but not yet, it's a moment of maximum pressure on that area. And it's very often that it compressed, this ganglion of Luschka, and he have an impact of all the parasympathetic system. And parasympathicotony is a state of being, ooh. And we call that more a physical depression, in fact. And you have the baby blues, you have many things going with that. There is not the only, there is a multi-parameters, the baby blues and the postpartum depression. But this is for us as osteopaths something that we really target to see how much this ganglion could be scrunched. And there is techniques to release it. Today I do well. In front of my colleague it's more hard. So...
So is that compression on the mother or the baby?
The compression is on the ganglion, which is in the mother.
Okay.
Yes,
and that's what causes the postpartum depression.
And when the baby finished to go out, when the ganglion has been squished, it continues to be squished, and it stays stuck like that. And so it creates an hyperstimulation of all the chain. So it puts, instead, you know, sometimes we say this person is in orthosympathetic system or sympathetic disease, which is always on the go, hyperactivity, and parasympathicotony is like that. You know, when you go to sleep, you go on your parasympathetic. So and so if you inwardly feel like that, you feel a bit depressed. You know, it's like a physical depression. That one. So, Anne. Another midwife.
In the video, it talked about prevention for colics, digestive disorders, even autism. Can you expand a bit, one of you, to explain why?
I don't know. Is some of you? Someone want to talk about it?
Microphone phobia. And a light phobia. When you have compression in the back of the head, you end up putting a lot of tension into the spine and into lots of support structures that go down the back in the fascial body, and that can disrupt the nerves that would naturally go to the digestive tract and not allow proper health with that. And so completing the birth spiral and allowing the baby to come back into a flexion state, which is the beginning of our life. We stay in a flexion state for the first bit, and we develop our anterior chain. Allowing the completion of the birth spiral had the baby out of where the baby was back in an extension state and stuck in the back, and allowing the support structures of the fascia and the nerves to go to the digestive tract and allow better health. I know there's a lot of, I don't know all the research on autism.
Well, okay, it was mainly the point of autism. Yes. Well, now I was talking with Michel Audin about the autism and the real proof of what could cause that. They have seen that the problem of immunity, which the only research which is really serious today on the link between birth and autism is linked to the C-section program besides the C-section in labor. And there is you will have on our website this study, because I think it's really the first study concluding to an effect of this immaturity of the immune system and autism. We know that autism has a big spectrum of causes, but when a baby has been very damaged on his brain just because of the birth, it could of course create some predisposition to develop this kind of neurologic disease. But there is autism which has caused heredity cause, defect on DNA, and it could be part. There is several things that is a bit, of course, short to say it could be linked to autism. But any damage of the nervous system could come at birth. Yes. And yes, another question. Last one. Thank you.
Okay, so if they are born with the autism or anything like that, at what age is it? How late is too late? Can you treat a 13-year-old, or for some of those? Reverse it.
For yes, but you mean how we can treat autistic syndrome? Oh, in general. Well, in general, someone won't release the mic, or I can continue. Okay. Well, the general we could diminish a lot of these 10 symptoms, and because when the fascia in the baby, any kind of structure have been compressed for physical reasons and stress reasons. If the baby has been really in stress, in distress, there is an action of the nervous system could come from inside the baby, and the external action of the compression between the structure of the mother and the baby. Both together, the tissues tend to stay compressed, and the cells are retracted. The tissue are retracted. And what is the beauty of manual therapy is, with the hand we could create an interface who allow the tissue to. We take the kind of, if we want, whiplash or compression in our hands, and it gives us a neutral point who help the tissue to decompact and expand again. Osteopathy is based on this fact. So it's a bit like when someone is in distress, you take in your arm and you see that? We do that every day. We have beautiful work. And I take the opportunity to present the team of Invermere, because three of you are not Invermere, sorry, of Kimberley, or all of you three are working in Kimberley. Oh, just you. Perhaps you could. It's you.
Just introduce ourselves. Well, my name's Stephanie, and I'm from Australia, and I'm here with my husband Kieran. We moved here 8 months ago, and we're working with Julie. and we're working in the osteopathy practitioner practice, and it's going along quite well.
So if you have any patients that you think that or know friends who may benefit from osteopathy, we're more than happy to have a look and pass on our recommendations.
So my name is Tira Ashby. I'm the osteopath in Kimberley. I'm also a chiropractor. I originally had my chiropractic practice here, and I went back to school for osteopathy, so I just moved back in September. And so it's so great to be in the mountains. And yes, I'm very open if you have any questions.
I was lucky enough to move to the Kootenays 7 years ago, and wise enough to know not to leave. And I'm very happy to be here and to make it my home.
Wow, Crystalline, working with Francois, doing osteopathy in the area. I think with Francois we're kind of the traveling osteopaths. We live in Jaffrey, I go to Fernie, and then I go to Nelson once a month, and I go to Invermere. In the beginning I was going more, but now I'm going once every six weeks to support the Invermere team. But now that Julie got 2 more friends working with her, it's not as needed. And yeah, we love osteopathy, and what else to say, you know?
Well, could you guys actually say a few words really short about osteopathy? Because a lot of people don't know what osteopathy is, really. I mean, we see the facts and what you guys do, but like, could we have a short story of what it is, what it does?
Just I'm first happy that you have the references at osteopathy.com in the Kootenay. And so, because it's more you will take the use to walk with us, and I hope next year when we do the Congress to present more and more alternative to the medical classical treatment through acupuncture, through other therapies, NLP and other stuff who could really help and change the destiny of our children. So until that, you know, they need us. There's always an answer. And but in 2 words, osteopathy has been discovered in Missouri, Kirksville, and beginning the century before, 1874, 74. Passed my exam nearly, and so by a man called Steele, Andrew Taylor Steele. I was thinking of Steel Point, Andrew Taylor Steele, and something funny to know is one of his clients was the founder of chiropractic. And he was very impressed by that, and from that he developed chiropractic. So we are like cousins and we have here a whole family, osteopath and chiropractor together. And in osteopathy we have 5 tools to release the tissue. Tool which is more mechanical, very used by chiropractor now, but chiropractic has evolved so much with years that they have other tools now. Another tool which is visceral. We work on the viscera to release tension on it. We use just our hands to do that. And we have a third tool which is the myofascial aspect, which is all we have specific technique for myofascial release. And the fourth tool which is craniosacral, very renowned because a lot of people do just craniosacral in ad for massage or thing like that. And the last one which is biodynamic, which is another level, if you want. It's look like a bit the craniosacral approach, just a bit more pushed, if it's yes. More expanded, exactly. So it's a different kind of touch, and we address the whole body for any kind of disease, and we just don't treat. We are functional medicine, manual medicine. That's with any kind of functional trouble we address for that. So it seems to be a big promotion, but the main purpose is really that we have seen every day in our practice how it could help, and we will really hope to be able to present all the different kind of help we could provide. This is another reason of this Congress, is to really unite all the practitioners with the best we have, to really have a fast network and say, okay, we have that, okay, I'm not available, I sent to Julie, to Tira, or whatever, but because we are few and there is a lot of people, and it's good to know what we can do. Yes. So thank you so much. So happy to have our team here. You want to present me? Well, yes. For those who wasn't Microsoft, you want? Oh, sorry, c'est vrai. Okay. Yes, sorry. Now we have another movie, which is on the birth, postpartum, the file postpartum. We have a very short movie from the Professor Jean-Pierre Relier, and Professor Jean-Pierre Relier is a neonatologist in France, and he's world renowned because he has helped. He has really made a difference in neonatology in the world for premature children. He has written amazing. It should be no. Is it postpartum? Yes. Right. Okay. No. Perhaps could you come back on, or could you go to? Wait a second. It will be faster with me. And I mean because I know where it is. Sorry, Guillaume. Guillaume, tu peux venir. So we have this a 3 minutes movie, which is a funny way to present him, and he has written several books about loving the baby before he's born, and the anger of Adrian. So he is specialized on premature babies, and through by the observation of premature baby, he has been able to understand how should be why the prematurity is linked to so many bad circumstances around the birth, and through this baby, which are a bit extreme, he is one of the people who have made that baby of 1 kilo are now able to survive, and all consequences that go with that. And well, it's an amazing person, and you have just a little message of peace for us that Guillaume is going to express. Okay. So enjoy the 3 minutes movie.
Je
I dreamed of changing the world. You know, I was a child during the war, and there were bombings, deportations. I lived in a world of disasters, hate, discord, and of course, I do not know how I could change the world. So my childhood dream is an option that appeared to me when I was a doctor. I was taking care of new patients and children and asked moms questions and saw what happened before the birth. I noticed that all sick newborns who entered our service were victims of problems related to pregnancy, family problems, problems of husbands and mothers, and how to avoid all causes of abuse and suffering that are permanently imprinted in the evolving fetus and newborn. This preventing possibility would certainly one day change the world, and when all couples and women will realize the importance of the creation of this evolving being, the most important element to make this happen is unconditional love without selfishness, without pride, as it is commonly so too often. The child is an object, the result of an intense desire, but it is often to satisfy the selfishness and pride of parents. But how do we do then? You know, the day when the women and men will decide to have a child in the proper manner, not according to certain procedures at this time of assisted reproduction that are against nature and completely devastating to the evolution of humanity. The day men and women who love each other and understand that the child is the fruit of their love, it will be very easy to change the world. They realize that the child can become like the materialization of their love. And I think it is much easier to change the world from the conception of the child than working on adults who are now completely stuck in their habits, in their flaws. Most adult diseases are the result of the relationship between mother and child during pregnancy. So prevention is the best therapy. Love your child before it is born. Love the idea of having your child before it is conceived. Have a child in love. The environment, the most appropriate for conceiving, is made of beauty. Huh? Love and harmony. Yeah, I couldn't see love there.
So now François is going to bring us a synthesis of the most relevant research in postpartum breastfeeding and early childhood development. François.
So most relevant is what I've found. And I've organized an international symposium in Montreal a couple of times to try to know what is the most relevant, either in pregnancy as well as in for birth and postpartum. And so I'm just here to report what all this amazing research could bring us to us. Est-ce que tu peux aller sur la most relevant research? This one. So, okay. Wow, it's work. Okay, so the Professor Award has recently shown how close contact between parents and babies in the neonatal intensive care units, like kangaroo care, reduce the baby's stress and pain, benefits her immune system, her sleeping patterns, and her overall growth. Postpartum depression appears strongly linked to the compression of the Luschka ganglion, as we talked before. This ganglion ends the parasympathetic chain, and when overstimulated, it tends to throw the whole system in parasympathetic atonia, quite difficult to adapt to. A second child comes with lots of specific stresses. The worst being the fear or not to being able to love him as much as the first one. The second is a certain lack of connection during the pregnancy due to the attention given to the first child. Finally, when the baby arrives, he is often imprinted with all these stresses, and it's much more demanding than the first baby was. It's not always true, but it's something very often. So, just to add of ideas to have of postnatal events. Who is this man in Woman? Is a mother, a pregnant woman, a man like the other? Why our society is not able to arrange better conditions for mother and couple? When we are going to understand the importance of the presence of the mother and the couple around the early child, to root in them the sensation of security during the first 5 years, when are we going to be able to do that? A child secured will become a safe and benevolent adult. With you. We have already seen the educational effect of the nipples bacteria on the baby's immune system. This is something which is already known. Moreover, is it now proven that the breast scans the inner state of the baby and provides in few seconds every needed vitamin, oligoelement, mineral, and any fundamental elements. In the same way, the breast can warm up or cool down the temperature of the baby. All men know that the breast is so intelligent, but it was important to have research on that. A recent Scandinavian study shows that breastfeeding protects against allergies. Dr. I.D.E.A.L from the US has demonstrated that the introduction of cow milk before the age of 6 months predisposes to otitis. Other studies show that breastfeeding at least until 3 months tends to reduce later on the onset of type 2 diabetes and increase the motor and verbal skills. Dr. Harold Magoon, an osteopath, underlines that the pressure of the tongue during suction stimulates chemical exchange between the nipples and the nervous system. Jean-Pierre Amig, my father, with Professor Lubespierre's team, has been able to confirm that breastfeeding improves dramatically the establishment of the cervical lordosis. Studies show that mother's milk is the richest during the first 9 months. After that, its nourishing level decrease so much that breastfeeding take on essential a comforting function for the child. Weaning is a time to find out other ways to console a child who needs solace and is now ready for more autonomy. It requires an assessment of the child's needs and of the mother possibilities. During the 7th International Symposium on Breastfeeding and Lactation organized by MEDELA in 2012, some very significant discovery has been presented. Professor Peter Hartmann's team in 2008 found the presence of stem cells produced by maternal milk. We talked about that yesterday, and it's amazing. This opens a new understanding of the irreplaceable breast milk's powder to supply all the baby needs. Dr. Fontini has discovered in 2011 that maternal milk stem cells can become any kind of cells in the baby. Breast milk continues to the development of the fetus out of the womb. It is an amazing discovery, and specifically finishes the maturation of the brain. This opens an amazing understanding about the crucial importance of breast milk in the development of the baby, and opens new avenues for the cure of certain disease and the generation of human tissues. Dr. Lars Board has just discovered how the hundreds human milk oligosaccharides, HMO, interact with the baby's immune system, supporting it and avoiding diseases as the necrosis enterocolitis, blocking the transmission of HIV from mother to baby, for example, or death by infection, according to Dr. C.G. Victoria. This very complex sugar herald very promising research. All these researchers have demonstrated the huge utility of breastfeeding for healthier baby. Dr. I.D.E.A.L denounced that 2/3 of all drugs on the market are simply not evaluated as to their effect on lactations, and that's why they are not recommended just in case. It makes that only healthy mothers offer their breast to her healthy baby, and it deprives nearly all mothers on medication from breastfeeding, sustaining and protecting their babies. Dr. Corner considers the performance of a child shortly after birth to be the product of a combination of his genetic equipment, his intrauterine life, and his birth experience. During the first months, the cortex finalizes maturation, and all the central nervous system is very sensitive, fragile, and it is a critical period for any strong stress to imprint the brain and condition some of its functions. That's why it's so important to keep the baby home or not too much exposed to any kind of stress. During the 4 months of life, the sphenobasilar synchrondosis invaginates marks the efficiency of the cranial nerves. This should end regurgitations and colics, as the tense cranial nerves, the pseumogastric, now enjoys its newfound stability. It takes around 3 years for the baby to reach a relative autonomy of his neuromotor system. According to Dr. Fulford, the abdominal brain led by emotion is predominant until the age of 2.5. It is toward the age 3 that these reports begin to reverse. The emotional brain is strongly influenced by the emotional environment of the parents, especially the mother, as the mothers, as children, are their magnifying glass. So it is important to consider the emotional somatization of the child in connection with his parents and his immediate environment. Dr. Viola Freeman considers all physical shocks and severe stresses experienced during childhood potential dysfunctions that may later be expressed as dysfunctional learning or behaviors. Last year, Russian scientists has discovered that a human being presents an average of 1,000 microtears using a device of their invention. And now in Russia they have equipped a lot of hospitals to this device, and it's another amazing research and discovery to understand our state and how a lot of few compression, compaction by fall, but different things really damage our body and slow down all our function years after years. Until the first permanent tooth of the 6 years old, the development of the child follows the maturation of the sensory motor, which is ruled by all types of sensation. And after that, it will develop, make a fine-tuning of this sensory motor, but it's rooted during the 6 years. That's why it's so important to demonstrate tenderness and stimulate by nice imprint the children until that age. Dr. Neufeld demonstrated that the more the situation from the environment respects the children's neurological development, the stronger the foundation of their body and the sense of security. Neufeld invites us, for instance, to respect the maturation of the children's frontal cortex, knowing that socialization will not happen until age 7. Before that, aggression and intimidation are normal processes. It is useless to force children to socialize according to adult values. We must respect their need to play and meet others without forcing them to a much refined socialization. And we have the chance to have a representative of Dr. Neufeld here, and I'm sure we could have some answer of our questioning. And now a little movie, just an extract of a woman amazing in Quebec. She has made a very simple movie to understand the effect of heavy metals on Earth, and she has go all over the world to try to understand the effect of heavy metals. And she has made a movie coming from that. She has just make interview of researcher, physician, very classical, medical doctors. And from that, she was really amazed to see, there is no legislation on that, and they are used like crazy, and we don't know the effect. And it's just a little extract of that to make us have a reflection on that. And it's true that where they are the most in a high level, it's in dentistry and in vaccination. So it's not a movie she has made against vaccination or dentistry, but against heavy metals, which is absolutely not regulated. And yet all the researchers don't understand why it's still so often that we find on so many drugs when they harm definitely the nervous system forever. So I just want you to see that.
Okay, would you please rise and be sworn? Do you swear to tell the whole truth and nothing but the truth, so help you God?
I do.
Thank you. Seated. Everybody knows the value of vaccinations, and every time you testify, you tell us how valuable they've been, and we already know that. We're not here to say that vaccinations aren't important. They're very important. They've given us the highest quality of life of any civilization in the history of mankind. That ain't what we're talking about. We're talking about why they're putting mercury in vaccinations and why it's never been tested since 1929 when Lilly developed it. Mr. Egan, has thimerosal ever been tested by our health agencies?
It's been only there were those early tests that you know of that were done by Lilly.
And when was that test done? That was done in 1929.
Yes. And
okay, well, let's follow up on that. In 1929, they tested this on 27 people that were dying of meningitis. All of those people died of meningitis, and so they said there was no correlation between their death and the mercury in the vaccines. That is the only test that's ever been done on thimerosal that I know of. Can you think of any other?
No, in people, no.
Okay,
except for accidental exposures, overexposure.
Okay, so we have mercury that's being put into people's bodies in the form of this preservative and has been since the 30s, and it's never been tested by our health agencies. And yet you folks come here and you testify that there's no conclusive evidence, and the IOM says they favor, get this, they don't say they're sure, they say they favor rejection of a causal relationship between mercury and autism and other neurological disorders. Mr. Egan, can you say to me right now that that amount of mercury being injected into a baby will not hurt it?
It's impossible to make those categorical statements of 100%.
That's right. That's what I want you to say.
In any scientific endeavor.
So it is possible that the amount of mercury that's being injected, even in trace amounts, could damage a child neurologically, right?
I don't think it has that capacity. No. I mean, that's, we can argue.
I know, but you don't think it is, but you can't say categorically, can you?
Do I have evidence for every single child, for every possible dose? The answer is no.
There you go. We've been after this now for 8 years. Now, progress is being made, but sometimes I feel like it's pulling a wisdom tooth where they get in your mouth with both feet and both hands and they're jerking that tooth out. I mean, it's just so hard to get it moving. Why they have left it in the vaccines is because they say it's such a minute amount, it doesn't really hurt anybody. But that's begging the question. The question is it toxic or not? And it is. It should be out of everything that goes into the human body. And our health agencies, in my opinion, have been derelict in their responsibility of making sure that mercury is out of everything that goes into the human body, especially vaccines.
So it could be a long debate to talk about that, but there is not just mercury, there is other agents to support the microorganism put on vaccination or other drugs which are very harmful, like the silver and the aluminiums and other things which are not very welcome in our body.